So today we have Haripriya Kompala, and she is from Dammam, Saudi Arabia, originally from Tirupati, Andhra Pradesh, India. This is an OET nursing role play concerning acute pyelonephritis. So these are speaking sessions at Practice with Peter, Grand Master Class. We provide online training for selected nurses and doctors. So only those students who are really serious and dedicated, those who can spend quality time with us. So we train them, a handful of candidates. So today we have Haripriya. This is the card. This is the role play card. This is the role play card. So the setting is hospital ward. It's about a 23-year-old PhD candidate who was admitted 2 days ago. And he was diagnosed with acute pyelonephritis, which is otherwise explained as kidney inflammation due to bacterial infection. So this is the candidate card, and this is candidate card number 17. This is the nurse card. So this is the candidate card, and this is the role player patient card, role player card. So this is the candidate card. You all can go through this one. So you have 3 minutes to go through this card. So now we are going to start the role play. Acute pyelonephritis speaking. Haripriya Kompala. Haripriya Kompala, you can start.
Okay. Hello, good morning, Maggie. My name is Priya. I am attending nurse today for you. How are you feeling?
Nurse, I want to be discharged from the hospital.
Well, I can understand your concern. I do respect your feelings. For my better understanding, I would like to know what could be the reason for your discharge?
Yeah, actually the thing is, my condition. Actually, I was hospitalized for 2 days for kidney infection, and I feel better now. Although I was not last night, okay, and still cannot face food or drink.
Okay. We have been monitoring you since you came admission. It's good you are recuperating well, but at the moment still you have fever and you are not able to drink or eat, and moreover you had vomiting still, some vomitings, and you have persistent nausea, for which you need to treat with the proper antibiotics and intravenous fluid therapy. It is very essential for you for your kidney infection right now. So, what do you think about it?
Actually, nurse, this is the first time in the hospital, okay, and confused patients, and I am very upset. I am not directed at the orders, doctor's orders, because I believe that I will have to spend more time in the hospital, and I hate being here. I am here in lot of noisy atmosphere, full of noise, and patients make too much disturbance, and I am upset and tired and angry about this situation. The doctor, okay, is okay, fine, and you are fine, but I am desperate to go home. Please do something. I feel I'll be able to get adequate rest there. I feel I will take everything possible, antibiotics and painkillers by mouth at home. I am okay for that.
Okay, let me explain about your condition. Right now, you have kidney infection, for which we are treating with proper antibiotics and intravenous therapy. These two things are not available. You cannot continue at home. You need proper IV injections. I know that you can replace with oral antibiotics though, but it's not proper strong antibiotic. You need very fast and quick action towards your infection, because kidney is the vital part of our body. We have to preserve the function of the kidney, for which we have to treat appropriately and immediately. You understand my point?
Yes, nurse.
Well, nothing can replace home. I understand that, but you have to understand, right? At present situation, you have to be in the hospital. This is my recommendation, but I do respect your feelings. It's absolutely depend upon you. But it's my responsibility to explain your condition and the treatment modalities, what you have right now and how your body is responding to the treatment. How does it sound?
Okay, fine. And
you stay more longer. It would be a great beneficiary for you. You will get the prescribed antibiotics the 3 to 5 days. You will complete your course, and the bacteria will come down from in the blood, and the infection also will start to get rid of it, and your kidneys start healing. Those things are really can be happen if you stay with us, and we will monitor you close observation, and we will do the blood investigation, series of blood investigation, and from that we will modify your antibiotics. These are all things is possible only if you stay with under the hospital supervision. What do you think about it?
Okay. I understand your concerns, but what I want to tell you is, I feel I want to continue the treatment at home and I can come back if my condition gets worse.
No problem. As I said, I do respect your feelings, but please remember, if you go discharged without doctor consent, doctor is and hospital staff is not accountable for your future risk. You may have kidney failure and you have a risk of blood poisoning as well. So you have to think. As I told you, kidney is a vital organ. And you have to preserve the function of the kidney. You need to treat right now.
Okay.
So, do you have any second opinion?
Okay.
So, I can help you I can understand. I can help you I will try to make it calm and quiet environment for you. If you don't like the word, I will change. I will try. I can do some best for you. Is it okay with you?
Yeah, fine, but it's very tough for me to stay here. I don't want to stay in the hospital. I don't know how to tell you. I'm facing a lot of problem and I'm not at all interested to stay here. I don't understand the reason why I'm kept here longer.
Though it's not your choice, but it's good for your health. This is the only point you should think about your future. You have to prevent the future problems. You have to think about your future. You are young. You have to think about it. It's really important for you to take the right decision right now. As I told you, I will provide you comfort measures. You see, you can just assess you can see the situation, then you can decide yourself how it sounds.
Yes, I understand, and I totally agree with your points now, but okay, I'm not interested, but still on your words, I think, I agree to stay here. Okay, nurse.
I'm glad to hear from you that you understand. I gained your cooperation, and soon I will transfer to another ward and I will provide you comfort room for you, which is really you will enjoy it for sure. And you will continue only 1 or 2 days. You will stay here. No one likes to stay for long, but it is beneficiary for you. Within 3 to 5 days, we will reassess your blood works and you can discharge. You will go home.
Okay.
Is it clear with you?
Yeah, nurse, thank you very much. Have a nice day.
You're welcome. Thank you. If you have any other concerns?
No, nurse, thank you very much.
You're welcome. Please call at any time. We will be available.
Okay, fine.
Thank you, sir.
Now let's have your feedback. Okay. First one, don't say anything when I am talking. Just listen. Okay. First one is, what you have to do is, you have to know, you are very confident during the session. There is no doubt regarding that. You have a lot of subject knowledge. Okay, you have a lot of subject knowledge. That is what it is. Then, regarding that confidence, how do we know? We know by your command. Okay, we know by your command in the subject. So because of that, you have a lot of, confidence. And then you are speaking bold and very perfect with a lot of experience like that. So it conveys message that you are very efficient in handling things. Second one is, you have to avoid personal pronouns as far as possible. I, we, you. Try to avoid as far as possible. Okay, don't use too many times you or I. Avoid these things as far as possible. The next one, you said, how does it sounds? How does is already there. Why are you using again yes for sounds? Okay, how does it sound? How does it sound? That is enough. So no need of yes again, because does is already there. Does is already there, so no need of yes. So how does it sound?
Okay.
That's quite clear. Then next one, the bacteria will come down in blood. What do you mean by bacteria will come down in blood? So bacteria is somewhere and they will come down in blood, or the bacteria in the blood will be reduced. Come down or reduced, minimized, or
The
decreased.
infection will reduce. Infection will be minimized.
Yeah,
The
you can say
infection will
something.
come.
Quality you have to use, right? Okay.
Okay, sir.
So the infection, will be reduced or minimized or zeroed or come down. It's not appropriate here. Okay, come down means from where to come down. What is it? What does it mean clearly? So that is the confusion. Then we will do blood investigation. We will do blood investigation. Blood investigation will be undertaken. Blood investigation will be undertaken. Blood investigation will reveal, okay, the level of bacteria or something like that. We will do. Why do you want to say we? So blood investigation, okay, will be performed, or blood will be investigated, or blood investigation will be performed or done. Like that you can say directly. How it sounds, you said. Why did you say how it sounds? Again, this is repetition. This is repetition.
Okay,
and again you are saying it's does is missing. How does it sound? So does is missing here. Okay. And the sound, how it sounds doesn't find. Okay. How does it sound? Then you will be something you said, but I forgot what you have said. Okay, because I was focusing, I missed that one. Next one. Pronunciation is good. Okay. Pronunciation is good. No doubt regarding that. But you have to improve a little more. Then next one is the point, the way how you are talking. Use simple, complex, compound sentences. Use simple, complex and compound sentences more by adding, okay, by adding 2 or 3 sentences you can add. And you can increase the level of vocabulary also. Improve your vocabulary. Improve your vocabulary to C1, C2. C1, C2 vocabulary. I told you, right? C1, C2 vocabulary. So improve that C1, C2 vocabulary. And then try to use quality sentences. Quality sentences means it's not so easy to find quality sentences. What you have to do is, you have to listen to the various listening audios, okay, there, and reading material also. There you will find quality sentences. So how you are taking those, you have to create those sentences, make those sentences and send those sentences to me, so that I can improve those sentences and their quality and give you. Is that clear?
Okay, sir. Okay, clear, sir.
Okay, fine. So I have taken one session now, and in the evening I'll take another session, okay?
Okay, sir.
Okay, fine. Prepare and be ready. Now we have taken this topic. Now, how can we improvise this quality is more important. So, every sentence matters a lot. Every sentence matters a lot. So, you understand my point. You understand my point? Do you understand my point? Or you understand my point?
You understand my point?
Yes, nurse.
Immediately. You understand immediately. Immediately. You understand my point?
Yes, nurse. Do you understand my point? That is clarity.
Nothing can replace phone.
It is
you understand my point?
Do you understand is spoken, but the artificial intelligence is not able to catch that. Do you understand my point? It is spoken, but you have to clear that when the person who is listening to you should be able to catch that. So see here, how many times the word understand is there? This is,
Understand my point? Understand my point?
this is number 1. Okay. Now let us see here. Here we have one time.
Understand my point?
Understand.
I understand that, but you have to understand, right?
So
The
here
present
itself 3
situation,
times.
you
So how many times the word is repeated? Avoid repeating words. Avoid repeating words as far as possible. So how can you avoid? By using synonyms and antonyms, because they play a very important role. So use synonyms and antonyms and they will help you a lot. So for the students, I am giving the feedback here. You can follow the feedback either through the audio or through the written script. Then we have the final round of, this is what is the speaking test. And then the suggestions, the feedback. Now, next round will be corrections and suggestions for improvement. So this is the initial phase where we have conducted the speaking session. So I have given the speaking session, part A, and part B is the feedback. Next one will be part C, that is the correction, and part D will be suggestions for improvement. So guys, we'll meet once again with another wonderful session. So that's the end for today. Have a nice day. Bye-bye.